So once you start seeing a chiropractor, you'll have to go 3 times a week for the rest of your life, right? That is completely wrong, and that's one of the most common misconceptions that we get about our profession. I'm Dr. Jesse Cease here at Health Fit Chiropractic at Boca Raton, and I'm here to tell you why that misconception is exactly that, a misconception. So if you've ever been to physical therapy or anything like that, you understand that when there's a new injury or a severe level of pain, there is a certain level of frequency that's needed in the care plan in order to achieve the results that we want to see. Okay, so for example, if a patient comes in with hot low back pain, right, they're in a lot of pain, they're low back, they're limited in range of motion, one treatment might help them feel a little bit better, but there's a certain degree of, let's call it muscle memory, that exists that put that patient in pain in the first place, that we're kind of up against early on in a care plan. So because of that reason, we do tend to need to see patients a little bit early, or a little bit more frequent early on in care. So what our usual recommended frequency for a patient who is in a lot of pain who comes into our office is usually 2 to 3 times a week for 3 to 4 weeks. We're usually looking at 8 to 12 visit range, and we should see some significant improvement. Of course, that can vary based off of your lifestyle. Maybe you're extremely active and you're healthy, or you're super young and elastic, right? That number can drop significantly into that 4 to 8 range. We usually ballpark 8 to 12 visits for that acute phase of care. Once the patient graduates out of that acute phase of care, we tend to recommend, especially here in our office, because we are very sports centered, a lot of rehab exercise care. So once that happens, we tend to drop frequency a little bit, and it becomes a little bit more focused on exactly what your goals are. So maybe your goal was just to get out of pain, and you'd like to be released once you're out of pain and come back when you're in pain again. That's totally fine. But maybe you're interested in learning a little bit more of why this back pain tends to reoccur every 3 or 4 months, and you're interested in doing a little bit deeper of a dive, or you're interested in learning a little bit more about core stability and how to activate. That's the type of next phase of care that I'm talking about here. So that's called our subacute kind of phase of care, our rehab phase, and there's a lot of progress that's made in that phase. Usually we recommend care like once a week, I'd say, for 4 to 6 weeks. From there on out is usually our standard average frequency in that phase. And then we usually recommend to our clients, if they're interested, of course, is what's called a sports performance or a maintenance, you might have heard, type of care, once every 3 to 6 weeks, depending on your level of activity, just to kind of keep everything moving properly as a means of injury prevention and to kind of help you build some injury resilience. So I hope that answered some of the questions and kind of clarified that misconception of frequency of care that we so often see here in our profession.